what I really want to also do is really help all of our hospitals or clinicians think about what is the advantage of having a technology like a VMS, what it means to the business, what it means for them, what it means from their time perspective, right, too, versus trying to do that all on their own.
Yeah, so technology, like I said, is going to be the bridge of different stakeholder group, right? So if you look at VMS as a technology and the nature of interaction with such technologies, multiple stakeholders are involved here, right? So your talent acquisition team, HR, when it comes to contingent workforce, procurement is involved, and your staffing suppliers are involved, MSPs are involved, and the organizations are there, plus the actual talent and candidates, right? So
Right.
this VMS technology is now evolving to cater to the needs of all different stakeholders, right? So focusing on talent experience, focusing on patient experience, focusing on recruiter experience, focusing on hiring manager experience, right? It's going to be the central hub. And one of the key changes that we are seeing is the runway to change or the pace of transformation has shortened a lot, right? Earlier, what organizations were doing in 1 year, now they have to do it in 3 months or 4 months, and that agility is becoming a key factor here, right? So that's where the third party technologies, in a lot of cases, we have seen third party providers, the MSPs playing a key role in enabling this entire talent transformation because they've got the expertise, they have access to tools, and they are acting as an orchestrator in bringing VMS as a central technology and then enabling that ecosystem to coexist with each other.
Awesome. Abhishek, what are your thoughts on that?
Yeah. So, as per my vantage point, right, I see the future, especially from a healthcare ecosystem perspective, slowly but steadily working towards the North Star of 360-degree patient review, right? Where you know every detail that is required for a doctor to treat patients and to make them better. Now, certain steps have already been taken in that regard, which is of interoperability of EMR, EHR systems, right? Where your medical data can flow from one system to the other. Now, what is happening is through the advent of your wearable devices, right? If you're having some pulse oximeters, booming that data towards the cloud so that a person can be or a caregiver can actually monitor the health of the patient in a 360-degree manner. Now, to the other point, Jamie, that you said, what should be, executives be thinking about? So, they should be thinking about the benefits. Of course, there are multi benefits. They should be thinking about the risks and the cost to the point that Vignesh mentioned. But another aspect of technology is how is the user experience getting impacted? If
Yep.
a technology is there where the user experience is not good, that technology will fail because there is a person who is going to be behind that technology. So there is a plethora of technology tools which are there. It is the job, I believe, of professionals within the healthcare ecosystem to decide what are the correct moves to make so that it is not a technology overload which defeats the entire purpose of ensuring best patient care.